Hey, I'm Stefan Phillips from Block, and this is FutureNow. So what does real innovation look like in the NHS? Not just in tech, but in the lives of staff and patients. Well, today I'm speaking with Jamie Clegg from Milton Keynes University Hospital about creating smart spaces that go beyond energy and cost efficiency, redefining what it means to deliver exceptional experiences where human impact drives everything. Jamie, welcome to FutureNow. I'm really excited about this one. We've been speaking a lot recently about all the different things that you've been doing. There's so much I want to cover today. But if you can just maybe open up by telling us a little bit about yourself and also how you've ended up on this side of digital innovation in healthcare as well, it'd be really interesting.
Yeah, absolutely. Well, first of all, it's great to be here. Thanks for inviting me. I had an indirect path to health innovation. Originally, I did my degree in finance, and then I did work in innovation in higher education. But when I got to my 30s, I kind of gave it all up and went and taught scuba diving for 10 years, travelled the world. And when I came back, it was really important for me to do a career that I felt passionate about, that gave me the same kind of a sense of accomplishment. And so I originally went into IT training for Nottingham City Council. Then I began to work in social care, particularly around innovation in social care. And I found that the technologies we were looking at could have profound impact on people's lives and genuinely make a difference. And that was really important to me. So when I saw the opportunity to work on the new hospital programme, for me, I wanted to seize it with both hands. And I've now been doing this for 4 years and absolutely love it. So.
Sounds good. And you're still finding time for scuba diving, aren't you, as well?
I do, yeah. So I still try to get out and about and travel the world and mostly see sharks, and I really enjoy it still.
So let's start at the beginning then with some of what you're doing. And I think you've spent a lot of time sort of looking at and thinking about all the different obstacles to innovation within healthcare. What have you kind of found, and how have you and your team looked at overcoming those barriers to innovation?
So I think if I kind of begin at the beginning, so to speak. So when we first engaged with staff at Nottingham University Hospitals around their new hospital, the National Rehabilitation Centre, our first sessions with staff, they were literally pointing to bits of dusty technology on shelves, and there was very much a sense of, we've been here before, we've been trying to do this, and their voices weren't really captured. So we wanted really to change that narrative. We wanted to put staff and patient voices at the very centre. So I think capturing staff voice, because nobody knows what technology is best for them than them, and also measuring the patient impact are particularly important. I think another area is we don't have great baseline data to contrast and measure the efficacy and impact of digital intervention. So we have to kind of almost start by creating those baselines we can measure against. We've also got challenges around legacy estate. I think is it like 13 billion of backlog maintenance currently within the NHS. So we've got buildings with asbestos. We can't get access. There isn't space. So a number of challenges like that. And I guess of all, I would say probably resource. So the lack of funding, lack of time, getting access to clinical staff is really, really challenging. So I think resource is another big element.
Yeah. Certainly from a budget side, how are you finding ways of overcoming that at the moment? Are there different things you're looking at to try and find funding for different things?
Absolutely. So I think in the first instance, the new hospital programme itself is a once-in-a-generation opportunity. We never get the ability to build multiple hospitals at the same time, engage with commercial partners and really kind of make a monumental shift. But there are also several different benevolent funds, like the Cisco Country Digital Acceleration Award, which we've used to allow us to fund proof of concepts and proof of values, and essentially create ecosystems that get staff and patient really feeding into the design.
Okay, that's good. Tell me more around I guess one of the biggest challenges I see out there is trying to get estates and digital all speaking and all working towards one plan, and that sort of convergence of the two I think has become a big blocker and challenge for some people. Tell me more about how that looks in a sort of frontline healthcare setting.
Absolutely. I think traditionally digital and estates haven't worked closely together, but a smart hospital by design relies on digital systems, but it also needs the input of estates and facility staff. Similarly to how I mentioned around clinical staff, they're the people that know what they need the most. And a digital hospital is a hospital without walls. It's a hospital where you can have care in the community, but also it's intuitive. So the building itself needs to be intuitive. All of those traditional estates technologies like CCTV, access control, they really do rely on digital technology. So it's imperative that we work together as a team, and also capture, essentially one of the biggest beneficiaries of staff and patient, improving the environment in which care is, given and also received. It's really, really important. We want to reduce noise, we want to have better lighting. We want to not get lost when we're navigating hospitals. So it's really important that we work together on those goals.
Yeah, it makes sense. And you mentioned there around noise reduction, and one of the stories we were talking about just last week was around the noise reduction within the National Rehabilitation Centre at Nottingham as well. Can you maybe tell us a little bit more around that, and also maybe the wider project at the NRC and what you did, where that came from, and everything that you looked to achieve there?
Yeah, absolutely. As I mentioned earlier about the first time I engaged with clinical staff, one of the other things that really hit me was the noise. The nurse call bell did not stop in the whole 3 hours I was there. And I was left with a sense of wonderment. How do people work in this environment, delivering intense care? And they would mention that the nurse call bells drive me potty, I think was one of the responses we had from our questionnaires. And so we really wanted to look at how we make that environment better, but also from a patient perspective. You have patients recovering from the most profound of injury or illness. How do we make that environment better for healing? So what we did is we put IoT sensors throughout the building. That, in one essence, allowed staff to see what IoT could deliver. So we were able to measure things like air quality, noise, light quality, occupancy, that type of thing. But it also then gave a baseline that showed that the noise levels were far, above what what you would want in a healthcare setting. So it was kind of twofold, really. And what we wanted to do then is investigate the problem and how we could resolve it. And we were able to show a direct correlation between the number of nurse calls and the noise levels. And first of all, we looked at silencing the alarms and sending mobile alerts to staff. But we also looked at how we could optimize workflows. So rather than send everything to a nurse who's in charge, could some of it go to catering? For example, if a patient wanted a glass of water, could that go there? Or if a patient wanted to be turned, could that go to a porter in staff? So we looked at how could we make those workflows more efficient. And that kind of, as I'm talking through this, you can see how these dominoes start to connect. So similarly, we have patients with kind of mobility impacting conditions. And what we wanted to do is look at how technology could aid in creating the outcome of independence. So, for example, using assistive technology to impact the environment, either through voice or things like blow tubes or eye gaze, to be able to turn on lights, turn on the heating, like cooling, that type of thing. But then that same technology allows a building to be more optimized in terms of if there's nobody in a room and it's booked, it'll switch itself off, so you're not using energy when you don't need to. So one of the things that really struck me is these aren't technologies in isolation. They're all part of ecosystems that staff and patients interact with.
Yeah. You've achieved so much at the NRC. It's a fantastic story, and there's been a lot of publicity around it as well. What was the kind of key to getting all that off the ground? What was different with that to be able to do it? Was it the funding element through there, or how was that any different?
So we were able to secure some funding through the Country Digital Acceleration Award through Cisco, but also we were able to get a really strong cohort of partners working together, because I think what really struck me about that project was how normal commercial relationships are quite financially incentivized, but this was very much we're all in this together. We kind of narrowed the gap between patient, staff and the commercial partners, so they could see the impact. They came to site, they spoke with different patients, with different staff members, and what we ended up with is a group of partners that would go the extra mile to create those outcomes and those benefits for people. So we had companies like UMA, we had companies like Contact.io for location services, but then ultimately Block were pivotal to that, because they were the integrator sitting in the middle of it all.
Yeah, that makes sense. I assume that from a partner perspective, that's very important in trying to bring all this together and bring it to life and support that journey.
Absolutely, because as you increase the number of technologies, you also increase your threat landscape. You also increase your susceptibility to outages. So it's really, really important that it's not just a case of putting technology in, it's putting it in a way that it's resilient, that it can be, you can depend upon it, and it's also secure. So having that kind of partner integration and someone who can work with these disparate technologies and converge them into one ecosystem is really, really valuable.
Yeah, that makes sense. And let's touch a little bit on the new hospital programme, because we've talked about it earlier on as well. So this is aimed at, it's a significant piece of work aimed at trying to modernise and create sustainable buildings in outdated facilities with advanced technologies. The sites have been identified. What makes this so unique, and are them unique to be able to go and deliver this?
So, as I mentioned, it's once in a generation, and the support centrally from the new hospital programme team is very much focused on digital technology, but also how it kind of crosses traditional silos and boundaries. So, we've never really had the opportunity to look at technology in this scale before. And also because it is a convergence of technology, buildings, people, we can really kind of go back to like a blank page and start from scratch and look at what do we need these systems to do to give the biggest impact. So there's a sense of responsibility to be able to deliver a hospital, not just the best one for Milton Keynes, but one that can actually you improve the system as a whole. Yeah,
makes sense. And there was so much that went into the NRC and the Linden Lodge proof of concepts early on. I guess, what lessons did you learn from that you'd advise to other trusts who are becoming part of this programme?
Yeah, it's a great question. I think first and foremost is putting staff and patients at the centre. The amount of times that we would look at technology that looked really great, in demonstrations, and have a nurse walk past and say, oh, that won't work because of X, Y, and Z. And guess what? They were right. So being able to, shorten the gap between the technology and the staff, and, really put those at the centre of that design is really, really important. Also, engaging with academic partners to do the evaluation and provide data that can help shape and also create a platform for other trusts to follow was really, really valuable. Working closely with commercial partners was also incredibly important. Like I said, there's so many challenges to make this work, and you need an ecosystem or a team that can kind of get over those obstacles.
Yeah, and I think you've mentioned a couple of times now as well around the piece of advice, just to don't wait to get started. You need to start this now because it takes a long time to get things off the ground. Is that still rings true with you?
Yeah, such an important point. It takes time to get these technologies to work together. It takes time to develop those relationships. It's not something we can wait. And we've talked greatly about the power of a proof of concept and a proof of value and what that can deliver. And this is the conversations I have regularly with other digital leads across the country is don't wait. You get on that journey as soon as you can.
Yeah. So tell me a little bit more around the business case, how you get started with this, and then more importantly, how we actually measure those outcomes that we achieve.
I think it's so important to have the ability to measure the impact of the technology we implement. And part of that is to work with academics and other partners that can do that empirical evaluation, essentially, so you're not marking your own homework. And one of the big challenges is we don't have baseline information that we can readily work against. So part of this journey is to implement things like IoT that give us access to data that we can then look at, what's the air quality, what's the noise level, that type of thing, how much energy are we consuming, and then what we do is have those academic partners evaluate the impact of the intervention that we've implemented, because ultimately we need to make sure that the technology we procure delivers for staff and patients.
Yeah, it's difficult because you're starting from that point where there's just no data on these things, isn't it?
Absolutely. Although I guess it gives us the opportunity to show the value of technology in that first instance. I think also, like, as you mentioned, business case, it's really important that we have like strong justification in the business case of what we're trying to accomplish, and ultimately we know that we've delivered it at the end of the project.
Yeah. Is there any advice or lessons you could give to anyone who's just at that sort of business case phase at the moment?
So I think in the first instance is engage with staff and patients, but also look for a suitable site to do a proof of concept.
Yeah.
I think very much this is about an iterative process. It can't be delivered on paper. You need to get technology in the hands of staff and patients. You need to have academics in. You need to see the different impacts and obstacles that are created. But then also that gives you the opportunity to get that buy-in, to get that ownership from the staff. One of the things that really struck me at the work we did in Nottingham was when we implemented location services. Originally what had to happen was staff would have to go to a screen, find the device, remember where it was, and then go and find it. And they were like, well, we're not actually saving any time. We need this on our mobile devices. And the company Contact.io, they created an application that did that. And that was fundamentally important. It changed the entire nature, because suddenly staff saw their voices had created an app, and they could then see that we are actually listening to what they had to say, and they really, really embraced the ownership of the project from there on in.
Yeah, and I bet they're much more willing to come and help and in future planning as well from that point on, if they can see the impact that it's having.
Absolutely. And also that what we want more than anything is their ideas, and it just sparks that, creates those dominoes.
So one of the things we're hearing so much around at the moment is with location services, it seems to open so many different doors for different services and different ways that we can impact healthcare. Can you tell me a bit around what you've done previously with this and what you're looking to achieve through location services?
You can also do things like geofencing. So, at the NRC, we looked at this for patients at risk of absconding or wandering, where they might have a cognitive injury or illness. But you can also do that for babies. So you can essentially be alerted if a baby is removed from the premises. I think initially there's some reservation from staff around what it means to be tracked, and potentially, as we all would, the fear of Big Brother. But what we found in the journey is that soon disappears as staff can really see the benefits this technology delivers. And what we found both in Nottingham and Milton Keynes is, from initial reservation, staff become the real advocate, because we've had the conversations around, well, could we track things like the contact time we spend with patients, so we don't have to do that manually. And they essentially begin to own that technology, because they can see it's got huge benefits to them. But you can also do things like contact tracing for illness, so you can reduce hospital-acquired infection by being able to track where that infection has gone and clean appropriately. So there's so many different things, and then leading into things like bed tracking and bed management, patient flow. So if you've got a patient going for an observation, like to have their bloods or have an x-ray, you can see where they are in the system, and you can reschedule other patients accordingly. So many different things you can do with location services.
It's amazing. There's so much we can do there. And looking ahead, we're hearing so much now around the capabilities of Wi-Fi 7, around the use of spaces, around AI and automation. So if we look to the future, what are you most excited about next?
There's so many. I think I'm really excited about Wi-Fi 7 and the kind of broad capabilities it offers.
Yeah.
Firstly, in terms of real-time location services, so the ability for patients to wayfind around the building and not get lost, the ability to find bits of equipment quickly and easily and potentially free up time to care from a staffing perspective. I think staff duress, the ability to press a button silently on the back of a lanyard that alerts security when, unfortunately staff are subject to violent incidents, and, making them feel safe, and it is one of the primary objectives that we have. Yeah. But Wi-Fi 7 delivers that without the requirement for any additional infrastructure. You do need a slightly increased density of access points, but those access points then give you greater connectivity. And we are now looking at putting medical device information across our Wi-Fi network. So the two things converge together, two sets of benefits. Yeah. The other element around Wi-Fi 7 that really excites me is the ability to converge IoT without the requirement for additional gateways. So that basically means your network works as a sensor without the need for other technology. Really, really important in legacy buildings, where you don't have containment, you can't get access for the things I mentioned before, such as asbestos. So I'm really excited about that. But then to take it one step further, we're now looking at open roaming. Open roaming means potentially you could arrive on site, be authenticated by something like the NHS app, and then instantly have a Wi-Fi, be onboarded onto Wi-Fi without the need to go through any kind of splash page. But that connection is encrypted, and because we now know you're on site, we can do things like check-in. So you can check into your appointment. We can give proximity-based messaging, such as your appointment's running a little bit behind, grab a coffee. But when it's your time for the appointment, you can then get a notification with a wayfinding link on how to get there. So really excited about how those technologies can work together, and also around things like AI, where we can remove some of the administrative tasks and potentially free up resources for staff to have more time to do what they got into the industry to do, which is deliver quality care to patients.
It's amazing, isn't it? It's going to have so much impact to patients and healthcare as a whole.
Absolutely.
And if we look 5 years ahead from now, and I think some of this you may already have touched on, but what's your vision for a truly smart hospital? What does that look like?
So for me, I think in the first instance, it's a hospital without walls. So whereas care will happen in the acute setting, it will also happen in people's homes where it's most suited to that individual. It's a hospital with a digital front door where staff and patients can interact with it through mobile devices or screens that allow them to impact on their environment, essentially turn lights, heating, cooling, that type of thing. It creates a very personable experience. And I think, take that one step further, it'd be data driven. It'll be a hospital where, we can see and react to what's happening in real time.
Yeah. How far away from that vision do you think we are right now?
So I think we've got a lot of the pieces. We just haven't got them all together in one place. And I think that's exciting in a way, because it's a case of we can see in different hospitals, there's some amazing case studies around the country and worldwide about what's been achieved, but no one's truly put that puzzle together yet, and I'm really excited to be a part of doing that. Yeah,
I bet, and I can tell the excitement that you have for it and the passion and everything that you've achieved. So there's so much innovation we've talked about, but how important are the foundations, the infrastructure, and especially the network to being able to achieve this?
So I really think the network is changing what it can deliver from just being connectivity. It's now a sensor that underpins everything. We have location services and all of the benefits that come from that. We've got the ability to put things like medical device information or patient observations across Wi-Fi. But one of the real important things is the ability to implement these technologies at scale. So the new hospital program have 49 different capabilities they want all of these hospitals to deliver. To have all of those disparate connections is incredibly challenging. So there are a couple of things that are really important. First, that this architecture is secure by design, and that's by the ability to rationalize the number of disparate technologies and use your network to deliver the vast chunk of those is incredibly important, because you can then have things like IoT that self-identifies, that has threat and vulnerability detection built in, but also you can do micro-segmentation on your network, so you can essentially partition different data streams, so that if one was subject to an attack, that it can't spread to other areas. So you essentially want to have a rationalized, simplified architecture. Really requires the network in the center of that, but also it needs to be secure by design. And again, a network has already have those capabilities in place.
So Jamie, throughout this you've talked so much around staff engagement. Why is that so important?
I think fundamentally staff are the biggest impact to patient care. So we've talked a lot about technology and what technology can do, but really it's staff. They're the people that are on the ground. They're the people having those engagements. They have the biggest impact to patient care. Unfortunately, currently the environment is not the best place to work. We've got high turnover, we've got people leaving, and all staff want to do is deliver care. That's why they got into this role. And therefore we have a responsibility to ensure we give them an environment where it's good to work, where we give them the tools that allow them to do their job, that where we make it safe for them and we reduce risk, because that is fundamentally what will deliver the biggest impact to patient care.
Can you tell me a little bit around your experience of working with Block as well? We've worked on projects in the past and how that's been.
Absolutely. I think paramount is for a commercial partner to understand this is more than just a business relationship. It's to have partner that will understand the benefits and outcomes we're trying to create for patients and staff. And I think that's where, or one of the areas where Block really excelled, is in that relationship and going that extra mile. But it's also understanding the complexity and having the capability to deal with all of the disparate partners that are involved in a project like this, and manage those relationships, and also encourage those companies to engage in that manner. I think, for me, that's the real kind of point that sets Block apart from other providers.
Yeah. Well, thank you very much for talking through that. It's really interesting to hear, and really excited to see what comes next from you and everything that you're doing out there as well.
Fantastic. Thank you, Stefan.
Thanks.